speaker from the Nutritional Abundance Organisation, known as NAO. Our goals are set out to improving nutritional status of people living in long-term institutional care to increase quality of life. According to the Australian Government, malnutrition affected 16% of people within Australian residential care in years 2010 and 11. A clinical assessment of nutritional status of geriatric patients found that out of 83 patients, both men and women, 20% of these patients showed to be having malnutrition of some sort. 20% to 50% were at risk of developing protein energy malnutrition. This indicates that there is a severe problem of malnutrition within residential aged care facilities. Results also showed that mortality was higher in those categorized with malnourishment, ranging from 40% after 1 year and 80% after 3 years, in comparison to those categorized as well-nourished, ranging from 20% after 1 year and 50% after 3 years. This clinical assessment backs up the idea that malnutrition contributing to an advanced decline in health, which can link to physical and cognitive disorders, thus increasing mortality rate. The emergence of placing importance on the nutritional adequacy in residential care is on rise, with malnutrition found to be affecting 50% of Australia's aged care residents, according to the ABC News. Elderly people with nutritional deficiencies tend to have faster health decline in the future than those well-nourished. In 2010, the estimated financial burden to health in aged care systems due to undernourishment in the population was $1.7 billion. The NAO sets out to reduce overall financial burden through preventing the malnutrition in the elderly population in residential care. To be able to achieve a successful treatment, it is required for nutritionists to be employed on site of the residential aged care, and those that are suffering malnutrition or nutritional deficiencies should be closely reviewed by nutritionists, as well as proper education to staff members and access of facilities needed. These actions are required to reach successful treatments because they are lacking in today's residential aged care systems, currently being no requirement for nutritionists to be on site, which heightens the importance, especially in rural areas of Australia. Malnutrition is not only common in elderly population, but is frequently overlooked, resulting in many health defects, hospitalizations, and death. There are many factors that can contribute to malnutrition. This can include eating, lack of individual care, loss of appetite from mental stimulation and sensory stimulation, reliance on supplements, food served in an unappetizing way, therefore residents do not want to consume, cultural differences, specific dietary considerations. Nutrition and food have a significant role in meeting the functional and physical needs for residents to contribute significantly to their quality of life. Therefore, a program such as NAO may benefit residential care participants through supporting overall health and well-being, acting as a preventative and reducing risk to further development in illness and health declines. A program linking all factors mentioned above, including residents, staff, as well as food, quality and quantity, is of need to reach successful results, which some or all are missing in residential aged care today. Thank you.